robotic surgery is the way of the future. Without robotic surgery, I would not be able to operate in a minimally invasive fashion. This is a complete game changer for head and neck cancer surgery. Head and neck anatomy is very intricate, and so it's been very difficult to operate on cancers through the mouth with line of sight instruments. In order for a surgeon to reach those areas, it would require a large incision in the neck. I would have to go through their jaw, cut their jaw, and open it up, cutting part of the tongue out or maybe part of the jaw so we can get access to those areas. Once we did get access to them, it's very difficult to reconstruct them. Patients that had these invasive surgeries were in the hospital for a long time. They had trouble swallowing, their voice would be changed, and some of the other senses, such as taste and smell, might be affected. Robotic surgery is the next step in treating head and neck cancers. Using a robotic system, I'm able to access their cancer without having to make a large incision in their neck. And that way they can go home sooner, return to work sooner, and have a lot less pain. Being dual certified in both otolaryngology and head and neck cancer surgery has allowed me to easily adapt this tool into my practice. In fact, I am the first otolaryngologist to perform transoral robotic surgery using the Flex robot in Oklahoma. There are two components to the Flex robot. There's the control system that has a monitor for me to look at, and it has a joystick for me to control the robot. And then the second system is the actual instrument and the camera. That camera goes through the mouth. It's flexible, so I'm able to look up towards the tongue or down left to the left tonsil or the right tonsil, or I can look straight to the larynx or the voice box. Then I insert the surgical instruments through that, which also flex through the channels that go along with the camera. There are two instruments that I can operate through the mouth with. There's usually a grasper I grab the tissues with and manipulate them, move them around where I need to. And then I have a cutting device that also goes through there. It can be cautery, using electricity to remove the cancer and the normal healthy tissues around it, because we always want to remove a small cuff of normal tissue around it. We call it negative margins. And so I use a cutting device such as cautery, or I can also use a laser, a carbon dioxide laser, to cauterize and cut at the same time. And so what I'm looking at on the screen is like I'm actually looking straight on to the cancer. This is a great distinction between the Flex robotic system and other systems on the market, which are line of sight. If you can't see the cancer, then you can't operate on the cancer. With Flex robotics, there's no limit to what I can see and what I can operate on. Once the system is in place, I operate, I remove the cancer without having to make incisions in the neck. And then once I get the cancer out, we let them recover. They're in the hospital for a couple of days until they can tolerate orals, eating and drinking. And once there, we let them go home. Even with patients who have undergone radiation, they can be candidates for transoral robotic surgery using the Flex robotic system. They might have difficulty opening their mouth if they've had radiation changes and their anatomy is distorted. I can actually use the flexible robot to go through and angle in a way that allows me to operate more easily through the mouth with these articulated instruments. My goal is to remove that cancer and to leave them with as normal as a quality of life as possible. Cancer is such a devastating disease that I want to be able to offer my patients the quickest treatment options possible. Having a Flex robotic system allows me to do that here at Cancer Treatment Centers of America.